Let's move on to more complex exercises, and first of all, in order to improve something, you need to learn how to assess it. We need a starting point so that we can track our progress. How can you assess your balance? There are some fairly simple tests, and we will do them together. Let's try to track our improvements, including by constantly retesting ourselves. In general, it makes sense to assess the impact of a particular exercise on your nervous system. And as we know, if we improve the incoming signals, the outgoing signals also improve. So how should we go about assessing something? Regardless of the exercise we're doing, whether it's for the vestibular system, the visual system, or for proprioception, we can assess any movement in the body. For example, a bend or reflection. I can assess how far and how low I can bend, or extension, for example, when I move. I evaluate the range of motion and the tension in the muscles from 0 to 10 points. For example, here the tension is 3 to 4 points, and if I extend even further, the tension is 7 points. After the exercise, we can carefully assess the sensations once again and see whether it got better, stayed the same, or maybe even became stronger. So, let's now move on to the practical part together. As we've discussed, it's important to thoroughly assess balance, so let's do this exercise and evaluate it carefully. Our current state. How can we assess balance? First, we have 3 foot positions. Feet wide apart. This can be wider than shoulder width, feet together, and the single leg position. The most difficult one. We can assess our balance in these 3 positions. First of all, we'll do a simple assessment. For this assessment, stand with your feet set wide apart, and to carefully assess your balance, we'll start gently moving the head in a controlled manner. We can do this either horizontally or vertically as you feel comfortable. We can do it with eyes open or closed at your own pace. I'll show you an example. I won't show the full 30 seconds, but you should do it for 30 seconds each time. And evaluate whether I can stand confidently and calmly without losing my balance during this exercise. So, feet set wide apart. The simplest and most straightforward way is to simply move, or rather, shift my head horizontally, with my gaze fixed straight ahead for a full 30 seconds, just as instructed. Usually this doesn't cause any problems. If you feel dizzy, don't push yourself to the point of discomfort. Stop if you start to feel unwell. So 30 seconds. Turn your head to the left and to the right. You don't need to turn it too far. Small movement, a small range of motion is enough. I don't have any issues here, so I won't dwell on this. Remember, you're doing this for 30 seconds. The next variation is with your eyes closed. And we also carefully evaluate our balance. If you start to lose your balance, make sure the environment where you're doing this is absolutely safe. Ensure there are no dangerous objects around that you could fall onto, step on, or bump into. It's better if there's a wall nearby. If you start to feel uncomfortable, you can hold onto the wall. And we assess our balance for 30 seconds. I shouldn't fall, I shouldn't lose my upright position. You can do the same thing vertically. I'll show it right away with my eyes closed. My eyes are also looking at a target in front of me, but they're closed. Alright, if there are no issues here, let's move on to a more difficult option. Feet together. A narrow stance. I think many of you have encountered this test in your life when you visited a doctor. Neurologists perform this test. It's called the Rumberg test. When we stand together, the only thing is, you're not asked to move your head. You are simply asked to close your eyes and maintain an upright position. By the way, this is also a variant of the test. You can use this for assessment. With our eyes closed, we shouldn't be swaying. What actually happens in this particular test? When we close our eyes, our brain must rely solely and entirely on the 2 remaining sensory systems, which are responsible for helping us maintain our balance and orientation. These are the body system, proprioception, and the vestibular system. Visual information is no longer entering the brain. Ideally, in a perfect scenario, we should be able to stand straight and stable, even with our eyes closed. That is, our brain should have enough information from the body and the vestibular system When our vestibular organ is not working properly or sufficiently, the signals are not properly perceived by our brain. In the necessary amount, we start to notice changes in body position, swaying, and waves. This tells us that, without a doubt, and in fact there is certainly something important to work on, and we need to train both the vestibular system as well as the body systems. Next, we move on to the version with head movements. You can start with your eyes open. Again, 30 seconds. Once again, what we are assessing is how stable we are, and whether any discomfort appears, or perhaps nausea or dizziness. Vertical with eyes closed. Choose the option that suits you best. I feel like I am stable enough. If I do this for 30 seconds, also vertically, and the most difficult option is the one-leg stance. We can assess both the left and right limbs. At the same time, I might be able to stand confidently on my left leg and, for example, lose my balance on my right. In this context, it means that the information from my right leg, for some reason, is not providing our brain with quality information. In other words, there is some kind of malfunction somewhere. Let's try both the right and left leg. So we start doing this first with our eyes open. I get into a one-leg stance and perform the exercise. Then here it's not so easy and simple anymore, even with my eyes open. "30 seconds. Vertical. It's easier for me vertically than horizontally. I managed it here. The same thing with my eyes closed. Here, everything is much more difficult. It's not that easy. And I failed the test. With my eyes closed on my left leg. You can do the same thing with your eyes closed, but vertically. It's also not very easy, but I am still able to maintain my balance. In fact, the type of footwear I wear often plays a significant role in this. We can do this test barefoot, and sometimes it gets significantly better. Because the foot receives a lot of sensory information, we feel the surface beneath us, such as its texture and firmness, and it's easier for us to keep our balance. That's why sometimes it makes sense to try this test without shoes. The same thing with the right leg. And first with eyes open. There are no difficulties here. 30 seconds. Vertical. And with eyes closed. So, "30 seconds. I can't manage to do this exercise with my eyes closed. This is also a starting point for me for improvement, for training purposes and for enhancing and developing my vestibular and proprioceptive systems. At the same time, again, I'll repeat that it makes sense to test yourself without shoes as well. Sometimes we can see a dramatic difference. You can also assess yourself in the same way for vertical balance. It's actually quite unlikely that I would get tired for the entire 30 seconds. So I found myself feeling just a bit unsteady and off balance when standing on one leg, with my eyes closed. I don't have any unpleasant sensations, there's no dizziness, so it just makes sense to train more complex positions. Another test is marching in place, for example, which can also help you assess your vestibular system and your balance. It's a very interesting and cool test, and here's how it's done. Arms out in front of you. I'm standing straight. I close my eyes, and I'm going to march in place. I don't lift my legs very high. About 45 degrees at the hip. So you don't need to lift them too high. And I march in place with my eyes closed. How many steps should you do? On average, you can do 50 steps. Ideally, you can even go up to 100 steps, but that's a lot. 50 is enough. I'm not going to do all 50 steps, I'll just show the essence of this test. So, arms out in front of you, I start marching and count the number of steps. I actually completed 50 steps and found that I moved a little forward and turned. Overall, that's a good result. Many of you may find yourselves, at some point, in a situation where you've turned quite a bit, or perhaps moved forward, then moved backward, and moving forward again is absolutely normal. We won't be able to stay perfectly still, remaining in one spot without any movement at all. If you move backward, most often it simply means that the vestibular organ is not transmitting quality information. And if we observe a significant turn, for example, more than 15 to 20 degrees, that also indicates that, for instance, the signals coming from the right and left sides of the body are different from each other. This does not necessarily mean that it is good or bad. Rather, it simply points to the current state of the vestibular system. And this can actually be a great test, one that's commonly used by professionals to assess and monitor progress. Well, now let's move directly to the exercises. Let's try to do something. But we'll start by considering that balance is not just the responsibility of the vestibular system, it's actually the whole body system, especially the important information coming from the spine. We'll begin with gently mobilizing the lumbar region. And in general, our lower back often bothers us. There's tension and pain there. And this is a simple, great exercise that it will help us feel a little bit better. Where do we start? First of all, use a stance with your feet hip-width apart. Next, we can use two targets, one on the right and one on the left. These targets should be positioned at shoulder height. They shouldn't be higher or lower. You can use stickers, anything you like. I can stand by the wall or use any other options. So what do? First, I slowly and carefully turn toward the target and reach in the direction of the target. At the same time, notice that when I perform the movement, I don't lift the opposite foot. My foot stays firmly in contact with the floor at all times. I reach to the left and perform this movement primarily using my back muscles. To the left, to the right. And by the way, this is also a pretty good option for vestibular exercises. Just like the previous tests, this exercise is a test. Here there is also a turn of the head and eyes. And we reach to the left, to the right, to the left, to the right. I won't overload you with complex neurology or explain that during these movements, our system that maintains posture is also at work, and this is a good exercise for it. And once again, to the left, to the right, to the left, to the right. 30 movements are quite enough. It's not too much or too little, but it's really, truly enough to actually make you feel a bit better overall. And I can also use the opposite hand. I reach to the left with my right hand. And to the other side, I can use both hands. With both hands toward the target. With both hands toward the other target. 30 repetitions. That's quite enough. Choose what you like best. Start with simple reaches. Make it more challenging, and make it even more challenging. The next exercise is a circular movement, a circle with the lumbar region. How do you do it correctly? It's very important to start from the correct position. Feet hip-width apart, knees slightly bent. I gently and slowly tilt my pelvis backward, tilting the pelvis back. And begin the next movement. I gently and slowly turn my thoracic spine to the left. My right hand. With my right hand, I gently and carefully reach toward my left knee, slowly bending, leaning to the side and gradually bending forward. The movement is performed specifically and precisely in the lumbar region of the lower back. I don't need to do this movement using my pelvis or hip joints at all, only using the lumbar region. I keep my pelvis gently tilted backward, then turn and bend. Now I feel a stretch in my back, on the right side. Next, I make a gentle circular movement right in front of me. I do this slowly and carefully as I gradually move to the right. My pelvis, however, does not move at all during this motion. In other words, it absolutely shouldn't look like this. Only using the lumbar region. Remember, this exercise is called the lumbar circle. I move to the right, and now I feel a stretch on the left side. I try to intensify it even more. And then I straighten up. Once again. Now let's stop to the right. Turn. Tilt. Bend. Stretch on the left, and very slowly and gently, I move gradually toward my left leg. From here, I return right now. Now, let's do the second part of this exercise together with me. A half circle from the back. The same thing. I turn, I lean, but this time I extend. Not bending, but extending. You can place your hands on your chest. I calmly continue to breathe through my nose. I make a half circle and return to the starting position. Let's try the other side. So once again, now turn, and then lean, and finally please extend. Return to the starting position. Now we'll combine both halves together to form a complete full circle. So once again, turn, lean, and bend. I relax my body slowly and calmly and continue to breathe deeply and steadily without rushing, focusing intently on the sensations and feelings in my lower back. I gently turn to the right and immediately go into a gentle extension. Bam! Just now, you have returned right back to the other side once more, and once again turn, lean, and bend. I can speed up. That is, this is not a movement of the pelvis, it's a movement purely in the lumbar region. Circular movement. 3 circles in each direction will be quite enough. By the way, assess how your back feels. I feel much more comfortable. It feels like I just worked out. And yet I only did a few simple movements. So what exactly causes this improvement? We provide sensory stimulation. Our muscles, as well as the receptors in our muscles, joints, ligaments, and even our skin, all send important information to the brain about movement and position. And we move very little in the lumbar region throughout the day. This is a great exercise. The next, now that we can feel our lower back better in our body, we can do the first simple exercise for vestibular stimulation. The pendulum. How is it done? I stand upright and imagine my body slowly moving left, right, and then forward and backward, just like a pendulum. Not just my upper body, but my whole body together with my legs, all moving in harmony. Imagine yourself as a single whole. Imagine a wardrobe that you tilt to one side or the other. To one side or the other. We look straight ahead, fixing our eyes on a target. And we start slowly leaning to the right, while gently maintaining our vertical alignment. If I press my arms against my body, I move as a single unit to the right and to the left. And I feel a strong tension in my core muscles. And I try to reach the critical point where I'm just about to lose my balance. My critical point is here. It's already very difficult for me. Beyond that, I lose my body position and also lose my balance and the overall quality of the movement. The same goes for the right side. And we catch ourselves. 10 repetitions to each side is quite enough. You can do the same thing forward and backward. Going backward is a bit harder. I carefully explore, thoroughly investigate, find the furthest point, and then make my way back. As I do this exercise, I carefully pay attention to the sensations in my foot throughout the process. I notice the gentle pressure of my foot on the floor, and I carefully pay attention to the sensations in my body. I try to really concentrate on keeping myself especially focused. Forward and backward. 5 to 10 movements in each direction will be sufficiently adequate. Try it out, practice.